Good evening, all. Welcome to our today's lecture. Today, we'll take a look at pharmacology, specifically the essential medicines, essential medicines, and the course code is chair 254. So the topic for today is management of essential medicines and supply. Management of essential medicines and supply system. That's the topic for today. So under this topic, we have some topics. We take a look at. The subtopics are as follows. We take a look at the definitions of essential medicines. The definition of essential medicines, definition of management of essential. So after that, we go over to discuss the objective drug program, NEDP, the objectives of National Essential Drug Program. Then we'll take a look at the steps for management of essential drug programs. Steps for management of essential drug program. They will look at the essential medicine lists. We go into some of the drugs we find in the essential medicine lists. Then we also talk about this essential medicine lists. Then after that, we now take a look at what steps in ordering drugs, and step in stock taking. The steps in stock taking. So these are what we are going to discuss under the topic management of essential medicines and supply system. All right, let's go. Let's see how far we can cover under 7 minutes. All right, let's go. So let's go to essential medicine. What is essential medicine? Before I go into that, basically, the drug needs of people in different environments differ. So you cannot uniformly say that people should use this drug, whether they can afford it, whether they need it or not, doesn't matter. No. You look at drugs that are actually needed by majority of the population in that location, and at the same time the one they can easily afford, the ones that are cost effective, and they must be generics, not so much of brands, because when a product is branded, the tendency for the cost to be high is there. So now, with this background understand, let us go to what we mean by essential medicines. What are essential medicines? Essential medicines are the preparation of those drugs, or simply those drugs that satisfy the needs of the majority of the population. The drugs that satisfy the healthcare needs of the majority of the population, and such drugs should be available. It should be available. It should be It should be readily available. It should be affordable at all times. It should be there at times. Very important. Readily available and affordable at all times, and it should be in adequate amount at all times. Adequate amount. Yes, that will meet up to the quantity they need. Should be there in adequate amount, and it should also be there in the appropriate dosage form. Appropriate dosage form. Adequate amount, appropriate dosage form. Very important. Do they prefer more of tablets? Is tablets what they take more? Is it injection? Is it a syrup? Am I complacent? In a place where majority of them are children and you load it with tablets, it's a problem. So these are things that we put into consideration. Not it at all that it should be there in all levels of the healthcare delivery system. At all levels of what? Healthcare delivery system. At all levels of what? Healthcare delivery system. At all level of what? Healthcare delivery system. At all level of what? Healthcare. At all level of what? Healthcare delivery system. Hope I've not gone out of the frame. At all level, okay, I've not. At all level of healthcare. At all level of healthcare. Sorry. At all level of healthcare delivery system. At all level of what? Healthcare delivery system. This thing is shaking. Okay, I think it's well aligned now. At all level of what? Healthcare delivery system. Yes. This is the system of the country in question. Of the what? Country in question. This is actually definition by what? WHO. That essential medicines are those drugs that satisfy the needs of the majority of the population. And these drugs should be where, therefore, readily available, affordable at all times, in adequate amounts, appropriate dosage form, and at all levels of healthcare delivery system of the country. This is the full definition of what? Of what? Essential medicines. Now, how can we define management of essential medicine? What is management of essential medicine? Management of essential medicine is just a program. It's a program that improves access to medication. Program that improves access to medication, while at the same time addressing the specific safety concerns of the patient. The specific safety concern of the what? The patients. In other words, you can say the management of essential medicine is just a service that is designed to help individuals manage their what? Medication. Simple. It's a service that is designed to help individual patients to manage their what? Individuals to manage their what? Medication. So it's a program that improves access to medication, at the same time addressing the specific safety concerns of the patients. So any of such service with this purpose is under what? management of what? Essential medicine. So every moment you see yourself doing this, you are managing essential medicine, especially our community health practitioners. Good. Not only community health practitioners, even pharmacists at all levels. Any healthcare or any healthcare provider that has one or anything to do with medicine, anytime yourself good doing this for a patient, you are managing what? Essential medicine. So the next term I want us to talk about is what? Supply system. What is supply system? What is supply system? You know, we've talked about essential medicine and what to do for patient to have access to this medication. Now, any human being, any facility, any equipment, any of all those things that you kindly employ to be able to discharge these duties in the program, make up the what? Supply. Any method, any human being, resource person, any facility, any equipment that you employ timely to timely and accurately provide for patient to have access to this medication in your program is under the umbrella of what? Be it method, any method you use, any human being you use to achieve that, any equipment, any facilities you use that. It can be a facility, can be hospital, can be clinic, you use to achieve that. Making sure that the mission of the program, which is providing access to medication, affordable medication to patients. Anything you employ, human being or animate or inanimate object, you employ to make up the supply system. So supply system refers to the methods, equipment, facilities, people employed in the timely and accurate provision of all items required in a program or a process or even a project, referred to as what? Supply system. So I have succeeded in defining essential medicine, defining management of essential medicine, and defining supply system. Now let's go over to objectives of the National Essential Drugs Program, NADP. So let's look at some of the objectives. Number one objective of this program is to ensure that most of the essential drugs are readily available to the population on a particular basis, be it weekly, be it monthly basis, whatever. But the mission is to ensure that most of the essential drugs are readily available. That is a very important mission of the program. So, any human being, any facility, any method you employ in helping NADP to make drugs readily available is a supply system. Okay. Forms a supply or part of the what? Supply systems. Let's go. So another objective is to ensure that the drugs, the way the patient uses the drug is safe and effective. So the use of the drug use are safe and what? Effective. Drug use can be effective, but it may not be safe. Yes. So you must be two of them, safe and what? Apart from being readily available, it must be safe. The use of that drug, there must be safety and effectiveness in the use of what? The drugs. So NADP ensure that this is achieved. Now, the next the next item on the objectives of this NEDP is to ensure that drugs are purchased in their generic name and drugs are purchased in bulk so as to minimize what? Cost. Simple. Drugs are purchased in bulk, central bulk purchase. That's why some states we have a central medicine store, CMS. Now we have central bulk purchase. Central bulk purchase. Drugs are purchased in the what? Generic, not brand name, not brands. Brands are expensive. Generic that are also effective and safe and are available all the time. Purchase in bulk, so as to they purchase the generic in bulk, large quantity, so as to reduce costs. This is gearing towards cost effectiveness. This gears towards cost effectiveness. This gears towards cost effectiveness. So generic name, very important. Generic name. Okay. Another objective of this NEDP is to ensure that only the drugs that are needed by the system are the ones that are what? They purchase. They bring in only drugs that are needed in the system. That means they would have carried out research to know the drug needs of the particular or the people in question before bringing those drugs. You don't just go and bring in any drug you like, maybe because the person is your brother or your father or your husband or your relative. You want to patronize them. You go and purchase the drug without even knowing whether they are needed. They will remain there and get and expire. In fact, this happens in most places today. You see them pack drugs you don't even know that is not even needed. They didn't even carry out research to find out the drug needs of the people. They just buy it because they have the contacts. They buy it and stock. They will remain there and expire. It's waste. It's economic waste. It's economic waste by the country. At the same time, the patients, the population that needs the drug will not have access to those medication. So have you seen the importance of this NEDP to ensure that it's only drugs that are needed that are supplied? Another objective of NEDP is that it makes sure that drugs are selected well calculated, the quantity needed well calculated before procurement and use. So it introduces a rational system of drug selection, calculation, and procurement and use. That's why we have rational use of medicine. Rational use of medicine. Rational use of medicine. So this NEDP ensure what? Rational use of medicine, rational drug selection, rational calculation, rational drug procurement, and rational use of medicine. Another objective of this NEDP is that it trains at all levels the personnel involved in drug management, in medicine management. The purpose is to have an improved drug management, because if these personnel are not well trained on all the program or what the NEDP want to achieve, they will not be able to achieve it, because it's those healthcare professionals that NEDP will use to be able to achieve this purpose. So they need to train. So they train and retrain these health workers to be able to achieve the purpose of what and the objectives of what NEDP. So they train the health workers at all levels. So they try as much as possible to discourage anything that has to do with fake drug, be it its production, its marketing, and its use. So they discourage the production, marketing, and use of fake what? Of what? Fake drugs. Of fake drugs. Of fake drugs. Of fake drugs. So these are the ones we can take for now on the objectives of what? NADP. Now let's go to the next subunit or subtopic. Let's go into the steps for management of what? Essential drug program or essential medicine. Anyone? The step for this management. What steps do we take in management of this essential drug program, essential medicine? The first one is selection of these essential medicine, essential drugs. Followed by, if you select, the next is to order, selection, ordering. The next one is stocking, and the next one is issuing and using of what? Essential drugs. First is what? Selection. Second is what? Ordering. Third is what? Stocking. Fourth is what? Issuing and use of what? Essential drugs. Use of what? Essential drugs. Okay. So let us now start take them one after the other. Selection. Let's take them one after the other. Selection. Of course, remember I said that you have to find out the drug need of that population. So from that drug need of that population, you select essential drug. Essential drug basically, of course, these things are going to be prepared in essential drug list anyway. So you go to the essential drug list. Align it. It's not all the drugs in the essential drug list you will pick. You have to localize it, find out what is happening in your locality. Very important too. So there may be some drugs in the essential drug list that you may pick, they may not be needed, and they may remain there and get expired. So you marry the two, the drug in the essential drug list and what they actually need. With that, you cannot select the proper drug. So you select the essential drug list that are needed at a specific health care facility. Very important. Determines the drug to be selected. Now let me look at the factors that determine the drugs to be selected. The first factor is what? Prevailing health problems. Yes, in that environment, what is the prevailing health problem? What do patients suffer more in that locality is very important. You start from that, the drugs that treat those ones. So, prevailing health problems. Then you also consider the training of these health workers in this facility. It's not all drugs that can be handled by anybody. So consider the level of training of the healthcare workers in that facility. Very important. You also consider the availability of funds. It's not just to put the drug, its funds available. That's why it's important to implement drug revolving funds. Drug revolving funds. We see treat it as a topic in this course. DRF, very important to implement DRF. Let's continue. So, availability of funds, very important. Funds, money, funds. Is funds available for this? These are things to do what? Consider. is to check whether the patient accept that drug. So acceptability, the form. Talk about the what? Acceptability of the drug. Does the patient in that locality accept that drug? And the dosage form they prefer. Some prefer tablets more to injection. And you leave tablet and go and pack injection. It's a problem. It's a problem. So most patients prefer and accept oral drugs to injection. So these are things you consider before choosing the dosage form. After choosing the drug, you also choose dosage form to purchase, to procure. Very, very important. If the locality is dominated by children, you go more of syrup than tablets. Very important. So you should also put that one into what? Consideration. Now, how do we now make this selection? Having looked at the factors that you look at before you select. Next step is how do we now make that selection? How? So having looked at the prevailing health problem, you review those prevailing health problems of the community. Because as you are reviewing now, you put also into account new common problem. As you review the one prevailing, there's also possibility of new common problem that exists. You also put into what? Into consideration those ones. You choose by generic name the drug that specifically treats those problems. You choose by their generic names the drugs that specifically treat those problems. Then you quantify what quantity do we procure. You now check the quantity you procure for each of these drugs. How do you now determine the quantity? You consider the consumption pattern. You consider the what? The consumption pattern of the drug in question. Yes, you calculate it. That will tell you the quantity. This is what you do in quantification. You tell the quantity to do what? Consumption rates. Better. Consumption rate of the drug, very important. Then you now determine the interval for ordering. Ordering what? Interval. First, review the prevailing problems and add new ones. Then secondly, you choose the drug by the generic name, tagging it with the what? The problem they treat. Then you quantify by determining through what? Determining of the what? The consumption pattern, consumption rate of the drug in question. Having done that, you now determine the ordering intervals of the drug. So these are what you do in selection. Now, the next step is ordering. So having done all these things, put all this quantity and everything, now you now make formal request. Of course, as you're making a request, you pay. You make your payments. You make your payments. So when this is done, the next thing is talking. If you receive, you now properly do what? Enter the quantity received, sign whatever document presented to you, then you now do what? Store the drugs in the store, in the main store, well arranged according to their what? Indication of pharmacological activities. Then when the need arises, you now issue. Maybe you can issue to the sub store. From sub store, you now issue to the dispensary, as the case may be, or you can issue to other healthcare facilities that needs the drug. So you now document properly in your stock card and what have you. So this is basically the steps for management of what? Essential drug program. So now let's look at another subtopic, the essential medicine lists. So if we define essential medicine as those drugs that meet the health need of majority of people, and it should be what available, affordable at all times, adequate amount, appropriate dosage forms, and they at all levels of healthcare delivery system of the country. If that is what we define as essential drug. Now, what is now the essential medicine list? It's simply the list of these drugs, the drugs that meet the health need of majority of the world, the population. Simple. So national essential medicine list. These things are classified under the following heading, under the classification, these classifications of drugs. You start seeing things like analgesics. Under analgesics, the one for pain, analgesic for pain. Also inflammation for fever. You see things like paracetamol, aspirin, acetylsalicylic acid. This one, aspirin is not for children anyway. Then you see what piroxicam, ibuprofen, there are many of them. These ones are under what? Analgesics. We'll see pick them one after the other and discuss them in our subsequent classes. But I just want to list some of them and examples. You have anticonvulsants. Here we have things like benzaldehyde, diazepam. Then we have anticonvulsants used in treatment or management treatment of what? Seizures, epilepsy, and convulsion. We have anti-allergics. Anti-allergics are for allergy. They tackle allergy. You see things like loratadine, chlorpheniramine. Then we also have antidotes. These ones are used to take care of maybe to treat drug overdose, also used for poisoning, against poisoning, to take care of, to treat poisoning. You see things like N-acetylcysteine for paracetamol overdose. You see things like atropine. You see things like flumazenil, even activated charcoal. There are many of them. Then we have our anti-infectives. They are for what? Treatment of infection. We have amebicide like metronidazole. We have antihelmintics like albendazole. We have, there are many of them. We have antibiotics. There are many of them. Then we have anti-malaria. This anti-malaria is also under anti-infectives, treatment of malaria. Here we have things like artemether-lumefantrine, we have artesunate plus amodiaquine, we have chloroquine, we have quinine. There are many of them. So under antibacterial, which is also under anti-infectives, we have many of them like erythromycin, cotrimazole, amoxicillin, ampicillin plus prostacyclin. We have ampicillin single, we have doxycycline, we have tetracycline, there are many of them. Chloramphenicol, ciprofloxacin. Each of these have their own subclasses. So, all right. We also have cardiovascular system drugs like methyl-dopa. We have the methyl-dopa, we have the nifedipine, we have the amlodipine. There are many of them. There are even diuretics for treatment for hypertension and for to take care of what? To remove excess fluid. We have things like furosemide, spironolactone, we are what? Mixed mag, compound magnesium trisilicate. You start having things like ranitidine, cimetidine, omeprazole, many of them. There are classes of antacids. We take the one after the other with time. Then we also have the hormones. We have the HCG. HCG is also the human chorionic gonadotropin. We have the clomiphene citrates. We have the many of them. We have follicle stimulating hormones. There are many of them. We have human menopausal wards. gonadotropics, and many of them under hormones and substitutes. We have synthetic substitutes of opioids. We have things like cocaine, heroin, marijuana, morphine, and what have you. All these are under what? Drugs under different classes, under drugs for what? Drugs we have in the essential medicines list. Essential medicines list. Now, there are criteria for selecting essential. We talk about essential medicine for selecting drugs that will be under this essential medicine list. That is factors that are considered to know whether you should include a certain drug or the other. That's what we want to talk about now. First one is choice of drugs. That must be in health. It must be in line with the health problem in that community. You cannot just choose anything. I have always mentioned this. You choose a drug that take care of health problem in that community. You don't just choose any drug you want. No. That is important. Of course, the drug must be effective. The drug must be effective when used now. It must be effective. Yes. And the drug must be available at all times. It must be available at all times and must manufactured locally. Locally manufactured drugs are preferred. Sorry, something is entering my office. I don't know what it is. Excuse me. I don't know what it is. So I needed to pause so that the thing will leave. But I've closed the doors, I've closed the windows. Sorry for the distraction. So the drug must be available at all times and must be locally manufactured. The drug must be satisfied by the WHO standard. In fact, it must be WHO certified. It must be of the standard of the what? WHO. And the drug must have a NAFDAC number. NAFDAC number. Demographic factors. So demographic factors must be put into consideration. For example, now in this population where you have number of children are more than that of adults. Now, you should also supply drugs that will take care of these people more than the other ones. Now, let me paint another scenario. In some population, you will have number of children that are more than that of adults. Then drugs that are made for immunization must always be supplied in the population. Very important. Apart from the pediatric drugs, where you have more of children, drugs for immunization must always be there. Very important. And where you have more of aged people, must always be supplied constantly. That's the point I'm making by considering some demographic factors. All right, I think our time has elapsed. It's exactly 6:41. We'll stop here for today. will continue tomorrow. Before the end of today, I will post the courses for tomorrow. And the time our lecture tomorrow will start